Hey guys, it's Jess. I have to do my head to toe assessment, so I'm going to go ahead and pan the room. Make sure that there's nothing in here to cheat with. Just a mess. Okay, I'm going to set my laptop on this stand right here. Okay. Can I have you sit up for me?
I don't want to have enough it up.
Okay, so I've checked the patient's chart. I've washed my hands. I'm going to come in and introduce myself.
Hi.
Hi, I'm Jessica. I'm going to be your student nurse today. Can you tell me?
Jessica.
Can you tell me your full name and your birthday?
Birthday is Mandy, and my birthday is March 15th, so it's after my papa's.
Okay. Thank you, Aubrey. And do you know what month it is?
November.
Very good. And do you know what season it is?
Winter.
Close enough. Started to say
Spring.
fall, but then said winter. Well,
Fall.
is it okay if I go ahead and do a head-to-toe assessment on you?
Yes.
Okay. So I've already established that she's alert and oriented ×3. So we'll go ahead and provide privacy for this patient.
Okay, well, we're in the living room.
Okay. Aubrey, I'm going to ask you a couple questions, okay? Do you have any history of headaches or...
When it's loud outside, I just go, ah! I have a headache, just calm down right now.
Okay, we're going to calm down, okay? And do you have any history of surgeries? You've never had any surgeries, not on your head, your chest, your belly, arms, legs? Okay. How about your eyes? Can you see well?
Yes, nothing's blurry or anything.
No blurred vision? Do you ever get dizzy?
When I spin around.
If you're not spinning around though, do you ever get dizzy? Okay. And do you have any problems hearing? Have you ever had any problems smelling? Have you had frequent colds? Have you had problems pooping? All right. And do you eat a good regular diet?
Yes, because I just eat I eat healthy.
You eat healthy and do you
Yes,
exercise?
Yes, I feed myself, but I run and I exercise, so I run.
And you run. Okay. Do you have any weakness or joint pain? No numbness or tingling? Okay. And do you have any lesions or bumps on your skin that you've worried about?
Nope.
No.
But
So-
when I get mosquitoes bite, yes.
Okay. And have you been diagnosed with any diseases like CHF, asthma? You've never been diagnosed with anything?
Yep.
Okay. And do you take any medications?
You're gonna have to take that as a no.
Okay. So throughout my assessment, I'm going to go ahead and I'll be assessing the skin the entire time, as well as assessing different body functions and making sure that everything's working properly and all of her nerves are intact.
Wait, what?
So, can you sit up for me, Miss Aubrey?
Only for a minute.
Okay. So as I'm looking at Aubrey and talking to her, she's able to answer my questions appropriately and seems to understand just fine. And she doesn't have any involuntary movements. She doesn't, no twitches or tremors or anything. And she is dressed appropriately for her age and her, and the situation. We're at home and she's laying around, so it's okay that her hair is a little bit disheveled. That's completely appropriate. So, Miss Aubrey, I'm going to go ahead and start by looking at your head, if that's okay.
Okay, fine.
All right. And I'm just looking at your head right now, and I'm noticing that it's normocephalic. All of your facial features seem to be proportionate. Okay. And you don't have any problems with your head or any hair loss or anything?
Of course not, Jessica.
Do you mind if I go ahead and palpate your head?
Yes, Jessica.
Okay. Do you have any pain anywhere? You have no pain when I'm pushing?
Nope.
Okay. And I'm gonna come down here and feel your temporal artery. Temporal artery is palpable at about a 2+ on both sides. Can I have you open and close your mouth? Good, I don't feel any ticks, and that is also testing cranial nerve number 5. And you said that you had no problems with hearing or smelling, so that tests numbers, cranial nerves 1 and 8.
1 and 8? Between 1 and 8 makes 13.
Right. So I'm going to have you go ahead and raise your shoulders for me. And lower them, good. Cranial nerve number 11 is intact. And we have previously used the Snellen chart to test her vision, showing that cranial nerve number 2 is intact. Ms. Aubrey, I'm going to go ahead and check your eyes.
Okay. By the way, when these two eyes are on the light, they go like this.
Here's my pen light.
My eyes can stay open when there's light now.
Yes. So I'm going to have you go ahead and watch the tip of my pen.
Okay.
And we're testing the 6 cardinal gazes. Make sure that her eyes are able to follow my pen in a relatively smooth manner in all directions. She did a great job. So we're going to go ahead. Can you look right at my nose? Good. Her pupils are about a 5, and they're equal and round. And I'm going to go ahead and check. Look right at my nose. We're going to check for a constriction. Make sure that they're reactive to light. And at the same time, I'm checking for consensual restriction or constriction. And her pupils are reactive to light appropriately in both eyes.
13.
So now, Aubrey, I'm going to have you look at the top of the Christmas tree. And then now I want you to look at the tip of my pen. Her eyes converged and her pupils dilated just a little bit. So we can say that her eyes are accommodatable.
I can look at my nose.
Very good. And she met all of the criteria for Perla, which means that cranial nerves number 3, 4, and 6 are
3,
intact.
4, and 6, that means 20.
Yes. Now, Miss Aubrey, here's the fun part. I want you to raise your eyebrows, puff out your cheeks, and smile. Very good. She's able to do that and keeping, you're being silly. She's got symmetric movements on both sides of her face, showing me that cranial nerve number 7 is intact as well. Now, I'm going to go ahead and look in your hair.
Make sure there's no bugs.
I am looking for any parasites, any lesions, any hair loss. We didn't feel any bumps. And you don't have any pain, you said, correct? All right. I'm not noticing any abnormalities. No parasites. So that's good. Nice and healthy, shiny hair. So I'm going to go ahead and move on to your nose now, okay? Do you have any pain with your sinuses when I push on them? No pain? How about up here? Pain anywhere? When I did her eye assessment, I did forget to assess her eyebrows, which they are equal, hair is distributed evenly, and the same with her eyelashes. Now I'm not noticing any drainage from her eyes, and sclera are white, conjunctiva is pink and moist. And I'm going to go ahead and look up into your nose, okay? All right. I'm not noticing any obstructions in the nose, any excessive drainage. You don't have any excessive drainage coming from your nose, correct?
Nope.
Okay. Go ahead and look up for me one more time. I'm going to check your septum, and I'm making sure that there are no deviations in her septum or perforations in her septum, which there are not.
Hold the pen.
You can hold it for a second, and then I'll go ahead and do your ears, okay? So, I'm going to go ahead and assess the ears. They are symmetrical, the same size, proportionate to her head, and you don't have any pain in your ears. So I'm going to go ahead and pull on the pinnacle.
Hey, it does feel good.
It does. We'll push on the tragus and push here. That's the push, pull, push test. You didn't experience any pain while I was palpating your ears, did you? No? Okay. So I'm going to go ahead and look inside. Can you turn your head to the side? And we're just looking for any bugs or parasites here as well, or any excessive cerumen, which there is not. All right. Thank you very much. Oh my goodness, I usually don't get hugs from my patients. You're so sweet. So what I'm going to do now is assess your mouth, okay, Aubrey? Well, perfect. So I'm going to check the buccal mucosa. Hard palate is white, or a lighter color, and soft palate is pink and moist. Her tonsils are about a 2. Teeth are all intact. You don't wear dentures, do you?
No.
Okay, sit back up for me. Let me see your mouth. And can you say ah?
Ah.
Rise of the soft palate and the uvula or midline, which tests cranial nerve number 10.
What?
So go ahead and stick your tongue out at me. That's testing cranial nerve number 12. And if I had a tongue depressor, I could check her gag reflex and test cranial nerve number 9, which I won't do that at this time. All right, Aubrey?
I do have something you can use it with. So that
No.
With...
It's okay, I don't want to do that right now. Thank you, though. So I'm going to ask you, is it okay if I move down to your chest? Can I look at your chest now? We'll go ahead and take your shirt off.
Okay, I'll get it off of myself because I don't want to get me hair all wrinkly again.
Okay.
Right, there you go.
Okay, so I'm looking at her chest, and I think I forgot to mention while I was looking at her face, she has her skin is appropriate for her ethnicity, and I don't see any lesions or abnormalities in the skin. All right. Now, relax. I'm checking the chest. Well, can you turn to the side for me a little bit? We're going to check for the anterior posterior diameter, which is a 1 to 2, which is great.
Pretend you gave me that when we were done.
Aubrey, you don't smoke or use alcohol, do you? Do you work in a place where you're exposed to hazardous materials?
I don't even work because I'm a kid.
Okay, wonderful. So you should be pretty safe then. And you don't have asthma?
Nope.
You don't take any medications that could affect your breathing? Okay.
But sometimes I do drink out of my nose.
All right, so I'm going to go ahead and palpate the anterior chest.
What the heck is that?
And I'm palpating for any tenderness or crepitus. No crepitus is noted. You don't have any pain? Okay.
We're touching right here.
So I'm going to go ahead and percuss the anterior chest and listen to the lung field starting up at the apices.
Why do you bang on me like that?
It's called percussion. If there were something stuck in your lung, I'd be able to hear it by tapping on you. Can you sit up straight? Very good, thank you.
Then you have to cut me open and get out.
Okay. The anterior lung fields are resonant with percussion, which is good. So we're not noting or suspecting any pneumonia or
What do you do that for? Give me a minute.
okay, baby. Shh. Okay. I'm going to go ahead and listen now, starting at the apices. Can you take a deep breath for me? Okay, breathe normal then. Puff your chest out. Okay, anterior lung fields sound clear, no adventitious sounds such as crackles, rails, wheezes.
Then you give me the pillow because I would do this.
Okay. This a little bit.
Then the last part you give me the pillow. You're
Okay.
being so good.
You can lay down right here on this pillow, and I'm gonna go ahead and listen to your heart, okay, while I have you here. Okay, so I'm gonna start up here, find the second intercostal space, just right of the sternum, and listen to the aortic valve. Come over, second intercostal space, just left of the sternum. And I'm listening to the pulmonic. Now I'm going to come down to the third intercostal space and listen to Herb's point on the left side again. Stay still for me. All right, we'll walk down to the fifth intercostal and listen to the tricuspid. And we'll slide down and over, following that fifth intercostal space, to the midclavicular line and listen to mitral. Very good. And I was able to hear S1 and S2 clearly. Rhythm was normal. I didn't hear any extra heart sounds or murmurs. And she has a faster pace rate, which is normal for a younger person. So can you please stop doing that? Please, you wanted to help me with my homework. Now please, thank you. So I'm going to go ahead and continue listening. I'm going to listen to her bowel sounds. Just relax. All you have to do is lay there. We're going to start over here in the right lower quadrant. And I'm listening for any vowel sounds at this point. And move up here.
Let's be busy while you're doing that.
Please don't shine it though. Okay, move over to the left upper. And down to the left lower. Very good. So I was able to hear active vowel sounds in all four quadrants. As I'm looking at her abdomen, I'm not noticing any heaves or lifts. Her abdomen appears flat, there's no distension. And I'm gonna go ahead and percuss in the same order that we just auscultated.
You're doing two?
Okay, so we are resonant in the entire right side and the upper left quadrants. The lower left quadrant has a bit of a dull sound, which could just indicate that there's something in her bowels that she may need to use the bathroom soon. So I'll go ahead and listen for any bruise while I have you here. I'm also looking at her neck, noticing that there is no jugular vein distension. Can I palpate your carotid arteries? Here, let me put this pillow under you so you're a little more comfy. There. So I'm going to go on the lower 1/3 of the neck and palpate the carotid arteries. Hers are very strong. We're going to go one at a time to make sure that we don't make our patient lightheaded. We can cut off the major blood supply to the head. Okay. They were very strong and palpable. I would give it about a 2+. So now I'm gonna listen for any bruise with the bell of my stethoscope in the carotid artery. Can you look up, hold your breath for me, okay? Okay, you can breathe, no bruise noted there. We're gonna go just a couple inches up from the belly button, just to the left side, and listen to the aorta. Once again, I'm not hearing any bruise. So we'll go here and listen at the renal arteries for any bruise. And we'll come down to the iliac. Can you keep your arm down so that they can see, please? Come down to the iliacs. All right, and no bruise noted there either. Okay, can I have you sit up? Turn around for me. Just sit crisscross applesauce and face the back of the couch. Okay, face the back of the couch for me so that I can show them your back, okay?
Okay.
I'm gonna go ahead and, okay. We're gonna listen the posterior lung fields. I'm gonna start by finding the bottom of the scapula, which comes to about T7, and we'll walk our way down T8, 9, and 10. So about here is her lung fields from C7 to T10. And I'm gonna go ahead and listen all the way down into the sides to make sure that I get the middle lobe, especially on the right side. I'm gonna start with percussing first though. So we'll start again up at the apices. Percuss. Be careful to make sure that we are in an intercostal space. They're not over the scapula. Come over to the side, lift your arm. Okay. Lung sounds are resonant across the entire lung field. So I'll go ahead and listen posteriorly as well. Take a deep breath. That's why I'm not hearing anything. Okay, one more time. Good. One more time, deep breath. Okay. Okay, breathe as clear as you can. Okay. Wasn't sure there for a second, but she's making funny noises with her mouth. Her lung sounds were clear though, and I'm not hearing any adventitious noises, once again, such as crackles or rails, wheezes.
When you're done, can you scratch my back?
And now I'm gonna go ahead and check tactile fremitus. So Aubrey, every time you feel my touch like this, I need you to say 99, okay?
99, 99, 99, 99, 99, 99.
Okay. Tactile fremitus was equal symmetrically, bilaterally, and the strongest, it was felt the strongest in her upper chest and diminished as we got down lower, which is to be expected. I'm noticing right now too that her spine is aligned. There's doesn't seem to be any scoliosis or curvature of the spine.
My spine right here.
Yep. So, and also the skin is intact. There aren't any bruises or lesions.
Mine are really
And
big.
no redness, blotchiness, and her skin tone is appropriate for her ethnicity. Okay? You can go ahead and turn back around for me. Thank you very much. So now I'm going to go ahead and assess your strength, okay?
Okay.
So I want you to squeeze as tight as you can. All right. Firm grips, equal bilaterally. Pull, push. All right. And the pull-push strength, her right arm is a little bit stronger than her left arm.
Wait, that's because someone's been cast for like 20 years now.
But she did just get out of a cast, so that's to be expected. I would maybe rate this arm at about a 1 and her left arm at about, this arm at a 3 and her right arm at a 2.
I mean, not a 1.
Okay. Now, I am also checking the muscles to make sure her left arm does have a little bit of muscle atrophy due to being in a cast for about 6 weeks. Good range of motion.
That was 13 motion.
You did good. So now I'm looking at her skin tone though and feeling. Her temperature is consistent. I'm gonna feel your pulses, your radial pulses, which are about a 2+ on both sides, equally palpable. Can I see your fingertips? We'll check. She has nail polish on, so we'll check cap refill on the tips of her fingers. Cap refill is brisk. And brisk on this hand as well. Very good.
You do this many fingers.
Oh, I forgot to
Take
feel your
mine.
lymph nodes. So I'm going to do your lymph nodes now, okay? So I'm going to start here at preauricular,
Does it hurt?
postauricular, occipital, tonsillar,
I need to bitch
submandibular,
Mama, my Jessica.
submental.
Jessica.
What do you need?
I wish I had some itchy medicine. Can I itchy?
You're itching? Do you itch a lot?
Yes.
Okay, we'll get you some lotion as soon as we're done here, okay? As long as you can just be good. So I'm going to go ahead and feel her supraclavicular lymph nodes and superficial cervical. Tip your head to the side. Deep cervical and deep cervical. I'm not noticing that there's any swelling in the lymph nodes. I'm not able to palpate any hardness, and she said that she was not in any pain. Please, we're almost done, okay? So, now I'm gonna go ahead and move on to the legs. Good. I'm gonna check your legs for strength. Push. Strong bilaterally. Pull towards you. All right, strong bilaterally. We'll check your calf refill, which is brisk in the toes. I'm not noticing any discoloration or edema. You don't have any pain in your feet, do you?
Nope.
Okay. And I'm going to feel for posterior dorsalis pedis and dorsal tibia.
This toe did hurt when you pushed it.
It's palpable but weak. I'd give it about a 1+. And posterior tibial. Can you relax your foot for a second? It is palpable on both sides as well at about a 1+. Equal hair distribution. I'm not seeing any signs of venous or arterial insufficiencies. And once again, no muscle atrophy in the legs. Alright, so go ahead and sit back up for me, and I'm going to do a couple tests. I'm going to take your foot here, and we'll do the Romberg test. The Babinski. Can I see your other foot?
I have a pen that you could use.
Negative Babinski. We want to make sure that her toes are not flying outward.
I do have
Okay, stay right here. You have to stay in the view of the camera, please. Thank you. Can you go ahead and stand up for me, Aubrey?
Yes.
Arms to your sides. Keep your eyes closed. And just stand there. Very good.
I would take 5 steps.
She was able to keep her balance, so that means that her cranial nerve number 8 is intact. Can you take a few
5 steps? 1, 2, 3, 4, 5, 6.
Okay, now come back and sit down.
And at 5.
Her gait is controlled.
I do have something in here that.
All right, well, my patient isn't cooperating anymore, so I think that I'm going to have to conclude my assessment. Thank you, Aubrey.
You don't have to. I'm going to let you do it right now.